Hi, everyone. Welcome in and welcome to the recording if you're watching this after. This is our GRCx on climate justice at our anchor institutions we have representatives from MIT, Northeastern, and Boston Medical Center here with us today. We're just going to give a couple minutes for people to join, as it usually takes a couple seconds for Zoom to let everyone in out of the waiting room. So we'll get started in just a few minutes. In the meantime, if you all want to share where you're joining in from, what institution, that would be lovely in the chat. So we know where everyone's tuning in from. And make sure that you all have chat ability. You do. Okay, great. All right, just to reiterate, hi everyone. We are starting in just a few seconds here. We're just going to let everyone come in to the waiting room and we'll go ahead and get started. We are joined today by Leah Bamberger from Northeastern University, Susy Jones from MIT, and Dr. Anna Goldman from Boston Medical Center. And we're going to be speaking about climate justice at their institutions. And if you all have a moment, please introduce yourself and in the chat and let us know what institution you are joining us from. So nice to see everyone this morning. All right, it looks like we're hitting a plateau here, so we'll go ahead and get started. Hi, everyone, and welcome once again to our GRCx program, Climate Justice at Anchor Institutions. My name is Untitled Chapter, and I am the GRC's Administrative Coordinator and Project Manager, and so excited to have you all here this morning, this pretty early Wednesday morning, so thanks for joining us. Before we get started, some logistics. If you have any questions throughout any of the presentations, please put them in the chat, and our staff and people behind the scenes helping us run the webinar will be collecting them for me to ask our panelists at the end. Please do try to avoid using the Q&A module just because it can be kind of confusing going back and forth between the different things. So feel free to just pop them in the chat and we will make sure that they're collected. And please make sure you stay off of video and muted when you're not speaking. I don't think you have the permissions, but if you do, please make sure that they're muted and they're off. And if you need closed captioning, you can enable them at the bottom of your screen. Last thing, this program is being recorded and we will put this up on our website along with the slides to make sure that you all have access of them. You all have access to them at the end of the presentation. Next slide. This GRCx will explore the potential for organizations to think beyond their own walls to accomplish what they can accomplish within their institutional missions. And so we're hoping that you all will take a lot of advice away, some tips, and also be able to have the chance to ask the people here and the presenters here with us today questions that you may have about implementing your own climate justice projects at your institutions. And so we're joined by representatives from 3 local institutions, as we have said already, to share projects that have demonstrated how they are actively supporting climate justice. So once again, we are joined by Anna Goldman from Boston Medical Center, Leah Bamberger from Northeastern University, and Susy Jones from MIT. This webinar and this program is an active part of the GRC's new initiative, the Climate Justice Network, which I'm supporting with Rebecca Hurst, our new Associate Director for Resilience here at the GRC. So once again, I'm really excited to have the panelists here with us today. It is such a power panel, and I'm really excited to hear from everyone. And I'll go ahead and give small introductions, and then I'll hand it off to Dr. Goldman. So Dr. Anna Goldman is a primary care physician and medical director of climate and sustainability at Boston Medical Center. In October 2023, she co-founded the Clean Power Prescription, which is what she's here to speak about today, a program to bring solar energy to low-income patients with energy insecurity. She has served as an advisor to Mayor Michelle Wu's administration on climate-friendly food procurement for anchor institutions in Boston and has decades and years of experience in the field. And then we are also joined by Leah Bamberger, who joined Northeastern as Executive Director of Northeastern University's Climate Justice and Sustainability Hub in 2022. She's currently leading the university's efforts to develop and implement a climate justice strategy that begins to align campus operations and development and engage staff and community members in and around the campus, which again, that's what she's here to present about today. So excited to hear from her. She was also the co-creator of Providence, Rhode Island, 2019's climate justice plan that was recognized nationally and continues to serve as a model for communities all over the US. And then Susy Jones is also joining us from MIT's Office of Sustainability, where she is Senior Project Manager. And that's where she also works on the intersection of climate, sustainability, health and well-being, and community partnerships. She currently lives in the Roslindale neighborhood of Boston, and she has a master's degree in urban and environmental planning from Tufts University and an undergrad degree from Bryn Mawr. And she has a range of projects in her portfolio, which are related to climate justice, low carbon commuting, DEI, food security, and more, the latter of which she will be talking about today. So with that, I will go ahead and hand it off to Dr. Goldman to talk more about the Clean Power Prescription. Thanks, everyone.
Hey, thank you so much for that introduction, Azanta. It's really an honor to be here today. As Azanta mentioned, I'm a primary care doc at BMC at Boston Medical Center. And I'm here to talk to you today about Clean Power Prescription, which is a program that I co-founded with our Chief Sustainability Officer last October. If you can go to the next slide, please. So I'll start just by telling you a little bit about Boston Medical Center. We're the largest safety net hospital in New England. We do approximately 1.2 million patient visits per year. The vast majority of our patients self-identify as people of color, and over 70% are covered by public insurance. We're also the largest provider of trauma and emergency services in New England, and we have about 10,000 employees. Next slide. As a safety net hospital, BMC Health System primarily serves a low-income population that has experienced a disproportionate impact of climate change and environmental pollution. And as a health system, our mission that we have stated is to make Boston the healthiest urban population in the world. So our goal is to keep the community we serve healthy and prevent disease. And therefore, we see sustainability in our health system operations and also having an environmental justice agenda as really truly core to our mission. It's not a side project or an added bonus. It's central to the work that we do to keep our patients and our community healthy. Next slide, please. So at BMC, we've been a leader for a long time in screening patients for social determinants of health, well before it was required by CMS. Our mechanism that we use is called Thrive Screening, and it's a tool that assesses social determinants of health, things like housing insecurity, food insecurity, difficulties with transportation, employment, and you can see a little excerpt of it here on the slide. We first rolled it out in 2017 in primary care in the clinic where I work, which is the adult primary care clinic. And now we screen all patients in primary care, pediatrics, and many in the emergency department. And so one of the questions on this screener is, do you have difficulty paying your heating or electricity bill? In 2022, which is the most recent numbers I have, more than 6,500 patients screened positive for energy insecurity, which is how, with this screening positive for this question. And that's probably a vast undercount because many of our patients don't make it that far down on the form or for various reasons don't end up filling out one of these. And in terms of what we do for those patients, historically, it hasn't been a lot. If a patient has gotten a disconnection of service notice from their utility, meaning they have such a high debt that they are starting to face that they wouldn't even get utility service anymore, a provider like myself can write a letter asking the utility not to shut off the service because, and we, we'll sort of mention the chronic disease that they have, that's a state regulation that utilities have to respect that. And so I myself have written plenty of those letters. In 2023, providers wrote more than 1,300 of those letters for patients. So it's a common problem among our population. And Massachusetts is one of the most expensive energy markets in the nation. The average low-income family spends 10% or more on home energy costs. In some neighborhoods, it's around 30% of their income. Sorry, I should say 10% of their income. Whereas a non-low-income household, or the average household, is closer to 3% of income. So it really eats up a lot of families' paychecks and money. Okay, next slide, please. This is the origin story for the program I'm going to talk to you about today. In 2021, I connected with a community group whose purpose is to install cooperatively owned community solar facilities on the roofs of community buildings and anchor institutions. At that time, they were called Co-op Power. And now they are known as the Boston Community Solar Cooperative. And I'm happy to talk more about that organization if people are interested. But it's a very cool model. Basically, they put a community solar array on the roof of a building that's owned by someone else, and that array is gifted to the community. It's owned and operated by low-income households, and then those households, you can take the model and do with what you like with the power. So in some cases, the households themselves could benefit. In other cases, they would sell all the power to one buyer. They have their first solar array on the roof of the Dorchester Food Co-op they just launched, and they're looking for other partners. And I loved this idea. I liked the idea of basically our patients being owner operators and getting that passive income as a way to build wealth and build asset owning in our community. And then also that they would receive the power. They would receive a discount on their electric bill through the power generated by this array. This is the idea. So we sort of concocted a plan. I pitched it to our to Bob Biggio, who's our chief sustainability officer. Now, at that time, he was our chief of facilities. And I, presented similar data on how many patients in our facility have energy insecurity, and asked if he would be willing to lease roof space. And his answer was that for a lot of reasons, we could not lease roof space. We couldn't enter a 20-year agreement because we actually have to put a whole bunch of technology up there, different air purifiers and all kinds of things. It's a really active space. But he had just finished completing a solar array on the roof of one of our administrative buildings. And he said, I like the idea of helping our patients. We were going to use this for our own energy needs. But if you want to create a program that helps our patients, you can do that. And that's how Clean Power Prescription was born. And he also was more familiar than I was at the time with Inflation Reduction Act subsidies that were available for renewable energy projects that directed energy towards low-income households that are specifically oriented around environmental justice. So that really made it possible to create this program. It made it financially advantageous for us, and I'll talk a little bit more about that in the beginning. I'm sorry, towards the end of my talk. So next slide, please. So Clean Power Prescription was born. So it was we're still in the pilot phase, and it launched in October of 2023. The array that you see behind me on the roof of 960 Massachusetts Avenue is 356 kilowatts is our DC nameplate capacity, and it generates electricity that flows through a meter that's owned by Eversource, and they count how many kilowatt hours we produce in a month, and then that produces a credit. Now we could apply that to our own account, and that was the original plan, as I mentioned, but instead what we're doing is getting account numbers of our patients and applying credits to their account, so it shows up directly on their electric bills. Households that are enrolled receive a total of $600 in credits over a 12-month period. So people are enrolled for 12 months. And it averages $50 a month, although it fluctuates quite a bit, actually, because during the winter, the array produces quite a bit less, and in the summer, it produces more. To be eligible to be in the program, patients have to live in Northeastern Massachusetts, in the load zone where our array is located. That's like a utility area, and have Eversource as their electricity provider, so that we can do that credit transfer. We are housing our pilot program through the WellSense Complex Care Management Program. WellSense is our associated health plan, our Mass Health plan, I should say. So it's all Mass Health enrollees, and the Complex Care Management Program is for people who are using more than expected, who have more than expected emergency department and inpatient utilization. So those are our patients who tend to have the highest needs, and that program is designed to address health-related social needs. So we have the capacity to sort of do a more intensive interaction with them and stand up a program like this. And our enrollment goal is 80 to 100 households for this pilot phase. Next slide, please. So we also are, because we are only enrolling people for 12 months, we are trying to do other interventions as part of the program that will improve people's long-term energy security and affordability. So we are referring patients, all patients enrolled get referred to ABCD. Many of you would be familiar with that organization, longstanding local social services organization, Action for Boston Community Development. They have an energy division. They help patients enroll in the LIHEAP program, Low Income Heating Energy Assistance Program, which is a national program that helps with the costs of heating fuel. The discount electric rate. They also will go into patients' homes and perform energy audits. They will replace inefficient appliances, things like light bulbs, but even larger appliances like a refrigerator. They will help patients get home weatherization, insulation, so there's a tighter envelope and the homes become more energy efficient in terms of heating and cooling. And then if a patient has delivered fuel like propane or oil, they will replace the furnace with an air source heat pump for free, which is exciting. And we're also working to help patients get out of competitive supplier contracts. We've seen a lot of this with early enrollment. So many of you may be aware that Massachusetts has a deregulated energy market, which allows basically predatory companies to come in and market directly to consumers. They say that they're offering clean energy. In fact, they're not doing that, and they're just creating huge markups and cost increases for people's bills. So this is an example of how to read your Eversource bill for any of you who might be interested. I've circled where you can see your energy suppliers, and many of our patients unfortunately have these enormous bills and have predatory suppliers. Okay, next slide, please. So this is my last slide. And this is a Globe article that came out at the time of our launch. So we see this as an anti-poverty program that's operating really at the intersection of environmental justice and economic justice. We are engaging our patients in the effort to fight climate change, and also we see this as a step towards a more just transition where we're sharing the benefits of cleaner and less expensive solar energy with our patients. And we are also leveraging the Inflation Reduction Act. If we have time, maybe I can talk more about that in the Q&A because I think my time is up. But just briefly to touch on future goals. So we hope to build more solar, both on our campus and elsewhere too, to expand this program, expand our capacity to produce solar energy that we can share with our patients. We'd like to see this model be enacted at other institutions, and in fact, NYU, where I presented last fall, is working on just that, which is exciting. Also, I'm still hoping to create a kind of a cooperative ownership model at some point with some solar that we will develop, but we'll see if that can happen. Okay, I'll turn it over to the next speaker. Thank you.
All right, thank you so much, Anna. This was so interesting, and I'm really interested to talk more about where you think that this could go and what projects you may have in store next for the Boston Medical Center. But projects like this are exactly what Boston needs, and what really what creative climate justice projects are capable of for in the city. So now I will pass it over to Leah to talk more about her work at Northeastern University. Thank you.
Thank you. That was incredible, Anna. So great to hear about that program. And I'm sure there are many questions. And hopefully Northeastern can learn from you and follow in your footsteps. So my name is Leah Bamberger. I'm the Executive Director of Northeastern's Climate Justice and Sustainability Hub. We are part of planning real estate facilities at Northeastern, but our mission is really to work across the institution and our academics, our research, our teaching, and perhaps most importantly, connecting with our surrounding communities here in Boston and across our global network. And doing this work with the goal of advancing solutions to the climate crisis and a just transition, and really making sure that our work at Northeastern, whether it's research, whether it's our campus sustainability, or our teaching is really serving the climate movement in a way that supports climate justice and those who are most impacted by the climate crisis. Next slide, please. So like many institutions in Boston and leading institutions around the country, we've long been focused on sustainability and reducing our environmental impact. Back in 2010, the sustainability team under our facilities division, this was before the hub was created. The hub is just 2 years old, but Northeastern released its first sustainability action plan. And this plan, like many of the time, really focused on operations and our greenhouse gas emissions and energy use. And it kind of takes this math problem approach to addressing climate change, looking at sources of emission and seeing where there are opportunities to reduce and hopefully get down to zero eventually. And this graph here shows our progress, the purple line being our actual use and relative to our goals and business as usual. And we've made great progress, but we know that getting the rest of the way, getting down to zero, is going to take a lot more kind of infrastructure and wholesale action. Next slide, please. On the academic side of the institution, Northeastern has played a prominent role in our efforts. Sustainability is one of the university's 3 main research pillars in our latest academic plan. We have over 300 sustainability related courses as the last count, or at the last count, and some incredible research happening across the institution from folks like Jenny Stevens, who I believe is on this call, Lily Song, who's working with communities in Roxbury, Joan Fitzgerald has done some leading work in climate justice in cities. And all of this work is being done through Northeastern's sort of approach to impact and experiential learning and research. So our sort of approach as an institution is very hands-on, very much engaged in real-world problem solving. So I think in many ways, Northeastern is uniquely sort of in a unique position to address these challenges and sort of have that real-world impact. And of course, we know that this issue is incredibly important to our young people and our students at Northeastern, who have really been pushing us and working with us to advance this work as we go. Next slide, please. But our impact, we know, extends beyond our energy use, our environmental footprint, waste, greenhouse gas emissions, et cetera. And in many ways, like any sizable institution, we act as a developer often in the community. And our environmental impact is really just one way that we have an impact on our neighboring communities. So things like housing affordability, increased cost of living, congestion on our streets, and other public spaces like parks. These are all things that we have an impact on, and are all very much connected to the environment around us. And so reducing this impact is important. And the city does have some good policies in place, like the IMP, Institutional Master Plan, and the related community benefits agreements to reduce that impact, or at least address that impact. Next slide, please. So Carter Field was the result of our last IMP and community benefits package. Really driven by the city's request, Northeastern invested about $100 million over 30 years in this facility. About a quarter of that was upfront capital investments to revitalize this park in a very significant way. And we continue to maintain the park, and we do have access. Our club and our recreation department has access to the facility, so our students are able to use the field. And sports teams in the community continue to regularly use the field. So in many ways, great project, mutually beneficial. Community gets a new park, Northeastern gets some expanded facilities, but it really didn't do much to change the real and perceived impacts of Northeastern on the community. I think many folks in the community saw this as further gentrification of their neighborhood. And there was a lot of good with the project, but again, it's that understanding of Northeastern as a developer. So as we embark on our next IMP, which we currently are working on, we're really trying to approach things differently and trying to think about how our institution as a whole and the mission of our institution can better serve our surrounding communities. Next slide, please. So this brings us to climate justice, because climate justice really understands and acknowledges the connections between all of these issues, from health to housing to gentrification and displacement, affordability, racism, redlining. Like, all of these systems are incredibly interconnected. And we've learned a lot about those connections, I would say, as a movement in the past 10 years, and certainly events like the murder of George Floyd, the Flint water crisis, COVID, all of these things really illuminated how different people are impacted by environmental issues, by the climate crisis, and how we really need to get at the root of these issues in order to solve the problems in a meaningful way. Next slide. So when the hub was launched, we began an effort to develop a climate justice action plan, and this is an update to that 2010 sustainability plan. So it had been a while. We needed to update that plan, but we wanted to do it in a way that really helped us start to align our community, efforts with community priorities. And so one of the most important things about this plan from the get-go is that we wanted to ensure that it was accountable to those who are most impacted by climate injustice in Boston. And we didn't have to go far outside our campus to connect with those communities. We also wanted to, in the beginning of the work, ensure that everyone working on the plan shared a foundational knowledge and understanding of structural oppression, racism, and climate justice, and how those things are connected, so that as we move through this work, we would be really getting at the root of these challenges. And then working together to identify the priorities and concerns of those who are most impacted, developing the vision, goals, and strategies of the plan, and then finally make sure that our plan at the end of the day meets those accountability goals. And I'll go on to talk about how we approach this. Next slide, please. So we created a steering committee with members of community leaders in our neighboring communities and frontline communities. And those folks included ACE, Alternatives for Community and Environment, Boston Ujima Project, New England United for Justice, and Reclaim Roxbury. We also had representation, and have, because the plan is still underway, from one of our contractors on campus, Thomas Carlson Corporation. So they are part of our sort of frontline worker on campus, and representing their interests and needs, many of which the employees work in our surrounding community. So really important to have their voices part of the process. And then, of course, we had representation from across Northeastern, including students, faculty, and staff. Next slide, please. So I mentioned we started with some trainings on structural oppression and environmental justice. And I'm going to just play the first clip of this video, as this was part of the training that talked about, developed by One Square World, about some of the issues in Boston and environmental justice, and sort of an example of how we're using art throughout this process to really invoke that human connection and emotion to the work that we're talking about. So hopefully the sound comes through. Go ahead. I don't think we're getting the sound. I think it's like a sharing setting. You have to share the audio. It's okay if it doesn't. I can.
Grace, you should be able to change the settings under view options or share settings to share, like optimize for audio.
Yeah. If that doesn't work, it's okay. It's a beautiful animation that goes through a actually, but if you could continue, there's one other video, so if you could continue to try to share those audio settings, that would be great. But we can go ahead to the next slide. And thank you, Victoria, for the link in the chat. So moving on from those trainings, we hosted community conversations and surveys, again, really focusing on Boston residents, neighbors to our campus, and wanted to really understand people's experience in Boston. So instead of asking community members, you know, what can Northeastern do to reduce its environmental impact, we asked questions about what's their experience living and working, raising a family, et cetera, in Boston. And we use the 4 elements: air, earth, water, and fire. Fire being connected to like heat and warmth, to understand and to dig into the connections to our environment. So how do you experience water in Boston? How do you experience heat, and what comes up for you when we talk about, you know, heat or fire? And we also asked, what is your ideal day in Boston? So thinking, like, doing some visioning and understanding, what are we working towards? And conversely, what are some of the biggest struggles or obstacles you face? And lastly, we had some questions about, what is your relationship with Northeastern? What is and what would you like that to look like ultimately? Next slide. And then the long and fun and hard process of co-creating solutions with the steering committee. So we did some deep collaborative work to identify goals, strategies, and actions throughout the fall and winter. And on the left here, you see the 4 goal areas that were refined through this process. And these goals, campuses will be models of sustainable, healthy, interconnected, and just communities, contributing to building a just and regenerative economy, enacting just research and academic practices, and building equitable relationships. These are our guiding goals for the hub and ultimately for the university as we think about climate justice and sustainability. And this plan identifies strategies and actions that advance those goals. And of course, there's some, the first one on like campus sustainability, that one is very familiar, I'm sure, to many of you, things like greenhouse gas emission reduction. But in that, we wanted to focus on what are the local impacts. So thinking about how, as we reduce our emissions, how can we prioritize emissions that address local air quality? Housing also came up a lot throughout the process. So we have strategies about expanding living options for students and investing in affordable housing in our neighborhoods, hiring and access to Northeastern, whether it as a place of employment or a place of learning, came up a lot throughout the process. And thinking about how we can continue to invest in our surrounding neighborhoods by supporting local and minority-owned businesses, whether that's through our procurement or creating spaces on campus for these businesses to connect to markets. Next slide, please. And then just 2 weeks ago, we had our final community conversation to share out the work that we have been doing back with community. It was an incredible event we hosted at the Huntington Theater, and I will, these kind of cardboard signs you're seeing a couple times in the presentation, these signs were all over the event. And what the signs did is they pulled directly from comments from the survey from community members and shared those comments and priorities and concerns on these signs. So again, just another way that we were using art to pull out things that we're hearing and help people connect with the work in a different way. And we also, our consultant team worked with artists to create, as another animation I'll show you about what an ideal day in Boston would be. We had 3 videos, one for a family, one for a worker, and one for a Northeastern student. And this was pulled from all the surveys, different things that people mention as what is important to them as part of their ideal day. And let's see if we can get the video to work. There we go.
I think my ideal day would involve being able to get outdoors. In the morning, before school, I walk or ride a bike to Squash Busters or Merino and get a workout in. Then stop by the Underground Cafe to support a Black-owned business. In the afternoon, I have class or join a couple Zoom meetings. In the evening, stop by the farmer's market, pick up something to cook for dinner, or, if I am feeling extravagant, get Ethiopian with friends. I don't spend more than $50 on all my expenses. After dinner, I head on a walk to do homework in Snell. That is my ideal day in Boston.
You could pause it there. It's going to go on to the next one, I think. Again, using art to really understand, and, you know, I think it helps, like, the questions that we asked that were really about understanding people's experience and sharing that out. And I think through that video, you can identify some of the themes and environmental or otherwise that come up that are important, like access to open space, connecting with community through their, you know, supporting various businesses and having those options on campus, food affordability and diversity of food options. These are all things that were directly said in the survey by students who responded. Next slide, please. And so I just want to emphasize, as we're kind of working on finalizing this draft plan, which is now available on our website, maybe Tori, you could put the link in the chat for folks to see more information on what's in the plan and what went into our community conversations. But as we are working to finalize, you know, there's, of course, a lot of tension. One of the things that really came up in the community conversation, what we're hearing from community members, is around accountability. They feel that a lot of what's on paper sounds really good, but they're not fully, you know, the relationship has made some great progress, but there's still a lack of trust that we're going to move forward and follow through on these. So the work ahead is not only finalizing the plan, but thinking about how we maintain those relationships through implementation of the plan so that we can really make sure we're being held accountable. And so the plan includes some long-term strategies and goals that we know are going to be more challenging. Housing we're not going to solve that on our own or in the next couple of years, but it is something we want to continue to work on and be aware of. But we are moving forward other actions that are building off of efforts that we already have. So Underground Cafe, mentioned in the video, that is a coffee shop on campus that is owned by a local business owner from Roxbury. It's a minority-owned business. We have a partnership with Madison Park High School where it's an apprenticeship program where we're creating pathways to hire directly into our trades and services division. We're looking at opportunities to partner with minority-owned businesses or co-ops like Sarah, who's our current composting business partner. And we're also exploring ways to think about how our campus can address urban heat island and build resilience to heat in the summer. So this past year, we had misters during the heat wave up just outside of Ruggles Station and some water stations for folks who are passing through to cool off in. So it's about finding that balance between building off of things that are already working and going well and addressing those priorities and concerns, and then also challenging ourselves to think bigger and really address other priorities and concerns of community members. So next slide, it's my last slide. Thank you so much, and I'll pass it on to the next speaker.
Thank you, Leah. I think I've been really honored and excited to be a part of, it's just not to be part of the process, but to watch you bring this to life since the very beginning. And ever since you were doing the community outreach and like the different classes and the different programs that you were explaining about racism and climate justice in Boston. It's been so exciting to see this come to life, and also like how comprehensive and how much detail you've paid attention to. So I'm really excited to speak more with everyone else about this. And again, just a reminder to everyone, Victoria from Northeastern also put a couple resources in the chat from Leah's presentation. So if you want to see more about the first video, she put that in the chat, and also the draft plan that they just recently published. And if you have any questions, again, please put them in the chat and we'll address them at the end. And then now I will pass it off to Susy.
Thanks so much. So I'm Susy Jones. I'm a senior project manager at MIT's Office of Sustainability. Thanks so much to Azanta and Rebecca Hurst and the Green Ribbon team for inviting me to participate today. And a big thanks to my very inspiring co-presenters, Anna and Leah. So much gratitude for getting to work in a city with such great peers. You show us what's possible. We literally bring this back to our team meetings on Monday morning and think about how to adapt or operationalize some of your ideas on our own campus, which is just so invaluable. So thanks for continuing to push the boundaries of what's possible. Today, I'm going to highlight a couple special food projects. I'm going to quickly touch on something called the Launchpad at MIT, and then I'm going to talk about this field fritter project. So from big campus planning to a little fritter. I'll start with a little overview about some of our guiding principles and goals at the Office of Sustainability. And I do want to mention that this work is so collaborative. So I'm just part of a team that includes MIT Dining, Commonwealth Kitchen, and many more. And the fritter project specifically, in particular, is really founded on this work of Healthcare Without Harm, who really spearheaded it. So I just want to acknowledge that context before I get started. So next slide. So before jumping in, basically just wanted to mention kind of at the root of the work of our office here at MIT is really considering climate impacts and solutions across these scales. So while our work is really rooted in the campus and in operations, we really see it as deeply interconnected to the individual, the community, the city, the state, the globe, and sort of fundamentally believe that these climate and sustainability challenges require partnership, deep coordination, deep collaboration across these scales, and then also across students and staff and faculty and researchers. So the campus can be a really great testbed environment, and at MIT, we really want to leverage that. So with this campus food work in particular, I always start with that question of how can we take a community approach? How can we partner and invest our resources that we have at MIT in the creative people and the ways that both make our campus better, and strengthen our neighborhoods, our organizations, our people, our farmers in and around Boston and New England, and with an emphasis on those who have been sort of historically marginalized or left out of this ecosystem. Next slide. So in terms of the food work in particular, kind of been guided by this vision statement for many, many years. On the left here, sort of envisioning a campus food system where everyone has access to healthy, affordable, and culturally meaningful food in an environment that we design to really bring people together, to highlight sustainability and equity and innovation. And then most recently, in the last couple of years, we've integrated kind of campus food goals into our climate plan, which we call Fast Forward at MIT. So on the right, you can see some food goals we've set for 2030, which most will probably find familiar if you have similar goals in your organizations, but really targeting a kind of 25% overall reduction in the greenhouse gas footprint of our food purchases, really trying to limit, kind of rebalance our menus to feature less beef on the plate. We want to recover all edible food waste in our dining and retail operations and create as many food recovery channels as possible. And of course, that sort of testbed environment. So using the campus as a testbed for innovation. Next slide. So you can kind of see here the foundational steps that the projects I'll mention today are built on. So this is a little bit wonky, but kind of takes you through kind of how these things kind of come to be institutionally. So the work began for us back in 2019 when we got this grant from the Kendall Foundation to do a very cool project with surplus crops with Commonwealth Kitchen and Boston area gleaners. That project did not happen. Commonwealth Kitchen is a shared kitchen space in Dorchester, Mass. For those that don't know, they really help small food businesses launch and grow. Again, especially those who have been traditionally overlooked or undervalued in the Boston landscape. So we kicked off this Kendall Foundation grant just a couple weeks before the pandemic began, and so we had to press pause. But this actually gave us time to develop a working relationship with them and sort of explore new horizons. And then that summer, in the midst of the racial reckoning and the pandemic, MIT made this renewed commitment to supplier diversity in 2020, really emphasizing the need to invest more and contract more with minority and Black-led businesses in the Boston area. And this provided this institutional support to integrate kind of the social justice lens into some of this food work, especially the Launchpad. So in the climate plan that emerged soon after, there is a section called the Imperative of Justice, which really highlights the need to decarbonize while centering justice and equity, which we really see highlighted in Leah and Northeastern's work. But again, it's kind of providing this fertile ground at MIT to push what's possible in the climate and equity landscape. So just this past summer in 2023, we were finally we had the capacity back to pivot that original Kendall food grant and repurpose it to scale this fritter project in the Boston area, which I will talk more about in a moment. So next slide. So quickly wanted to mention this one project. It's called the MIT Launchpad. Our dining team is happy to expand more on this to anybody in the future if you're interested. So this Launchpad was conceived of and implemented again in these kind of interim years, 2020 to 2023. It really turned our food court at MIT into kind of a launchpad for several small businesses that cycle through with Commonwealth Kitchen. You can kind of see here on this slide sort of the particularities of that relationship with Commonwealth Kitchen and how we kind of adapted our food court space to accommodate this model. Right now we have 3 businesses in there featuring Korean and Venezuelan and Somali halal cuisines. So it's Bibimbap's and Carolicious and the Tawakal Halal Cafe. And the students at MIT get really organized around this, and they send out a huge survey. I think this cycle they had about 700 or 800 students reply, and they really help choose the vendors that come in so that it kind of represents the cultural cuisines that they would like to see in the campus environment. Next slide. So the featured project, as I mentioned, is this pivot to support the development and expansion of this field fritter, which is made of yellow peas, which I'll talk more about. The long project title, I guess you can tell I was an English major, for this grant proposal was a collaborative plant-based protein strategy to increase the purchase and use of locally produced, climate-friendly, and culturally meaningful foods by institutional dining teams. But as I said, it's really the scaling of this field fritter project. So it's a 3-year grant. We have partner schools at the bottom, and I'll talk more about how we actually definitely have the capacity to include more schools even this spring and sort of being a little bit of a part of this experiment. Commonwealth Kitchen is our primary grant partner. And the goal was to take this field falafel, which was developed through a partnership that Healthcare Without Harm and Johnson & Wales and CWK, Commonwealth Kitchen, really set up to adapt yellow peas to make this field falafel that would be featured in the hospital communities around the Boston area. And so we wanted to take this and adapt it for the college market. So we changed the name from field falafel to field fritter in order to make the product kind of more of a template that could integrate lots of different flavors and spices and sauces, so it could kind of become more multicultural in our dining halls. Next slide. And you can kind of see some of the goals of the project here, kind of what we set out to do. So we wanted to take this original falafel recipe, kind of refine it a little bit through some testing, fine-tune the supply chain, this really cool local supply chain that was set up, create a distribution plan that could serve the campuses in the Boston area, create a couple good jobs along the way, potentially, and more. So really at the core kind of is asking this question, what if our our need to rebalance our menus on college campuses to meet our climate goals kind of meant that we began to transform the soils across New England to be healthier and better. We are able to make farmers' livelihoods more secure. We're able to create this product that can potentially serve Boston public schools to have access to an affordable, healthy, local meat alternative, and kind of create, a handful of good urban manufacturing jobs along the way. So these kind of transformative questions kind of guided us. Next slide. So again, yellow peas. So the fritter really begins with this input of yellow peas, which if you're kind of bored later on today, please Google, find out more about them sort of as a kind of regenerative cover crop. But in summary, sort of yellow peas are used, especially in this area, as a cover crop for really building soil health, but they can be used as this kind of dual cover crop and cash crop, which means that if we have a viable market, farmers can use it both to sort of restore and nurture the land, and then also get an income from it if we can kind of create a market, because if they are this very delicious and edible and healthy and protein rich and nutrient dense food. So as I mentioned, Healthcare with Harm kind of launched this pilot to build a market in the Boston area for kind of turning this yellow pea into a falafel with the help of Johnson & Wales and Commonwealth Kitchen. And then our job was to kind of think about how to scale this to college campuses. Next slide. So our initial, the farming partner that was brought in to help make this possible, called Aurora Mills and Farm, which is way up. If you Google Linnaeus, Maine, it's way up at the top of Maine. And we're actually, as more and more folks start buying the fritter, there's actually a need to reach out to more farm partners. So we're starting to see that, the ability to scale this beyond one farm to many farms, sort of nurture the land in that way, is beginning to scale up as more folks start purchasing the fritter. You can see this quote here from Sarah at Aurora Mills and Farm. So there you're able to farm in this regenerative way. They don't use chemical inputs. These cover crops really serve as kind of the fertilizer for the farm. And so the yellow pea is not just this cover crop, but it's also beautiful. It flowers, it increases biodiversity. There are more pollinators, and there's better water infiltration too. It grows fast, it kind of smothers weeds. So there's all of these really great kind of ecological and human health benefits that can come from growing this crop. Next slide. And so I just wanted to highlight, when I was talking to Sarah recently, I pulled up some quotes that she had sort of mentioned, and I don't know if folks get to talk to farmers a lot, but I think it is certainly important to center their voices in all of these food conversations. So just pulled out a couple quotes that she had said that I thought would be nice to highlight. So when I was talking to her about like, how hard is it to be a farmer? She said, sort of any farms that remain, these farmers are brilliant. They're soil scientists, they're business people, they're accountants, they're mechanics. They're really, really humbling the field. And then in terms of, I thought this was nice in the context of kind of New England resiliency, but sort of with Sarah's work and then other farms that are growing grains in New England, they're kind of bringing back this local grain infrastructure. In New England, we have water. Not everywhere in the US has water. So building that infrastructure here is really important. If something happened, this mill could process grain for the whole state if it needed to. So the importance of really investing in this infrastructure in New England. And in terms of climate impacts, I kind of asked, how's climate change affecting the farm? And she said, like, in every way. So this year was awful, too much moisture, smoke, crops failed, the buckwheat failed, didn't have enough photosynthesis. So the smoke literally blocked out the sun, and there was less yield. So you can really see the fragility of these farms as climate change ramps up. Next slide. So that's our farm partner. Again, our manufacturing partner is Commonwealth Kitchen. They are producing the fritter for us, led by Chef Kevin Doherty. So when we started this project in the fall, we just basically sent out a bunch of the field fritters 1.0 to every Boston college that we that wanted a sample. We just emailed our contacts. We kind of got this up and running. We sent everybody cases and cases of field fritters, and we had them cook them and taste them and get feedback and engage students and sort of do this recipe refinement and tell us what they think. Next slide. So at MIT, here's an example of the fritter on the line. You can see the recipe that we used, that our chefs used to feature the fritter, and the students put together a survey, and they kind of did some polling and asked for input. And we got inputs from the chefs as well. And what we found were kind of actually some mixed reviews. The way that it cooked, the texture, the flavor, it was good, but it wasn't great. So next slide. So we ended up collecting this feedback, providing it back to Kevin at Commonwealth Kitchen, Chef Kevin, and getting these chefs. In this picture, you can see we're at Commonwealth Kitchen at this Fritter 2.0 workshop in January with Boston College and Babson and Northeastern and Brandeis Dining staff, where we cooked and tweaked and sampled to make kind of a Fritter 2.0. And you can see the quote on the right saying, "This is a much better product from the original. It's excellent texture, held up better, more delicious." So this spring we sent out more samples to folks. So we're cooking and collecting feedback and kind of going through that process again. We actually can send up to 10 more college campuses a sample if you'd like. So if there are other colleges that are interested in joining on the call today, please email me after, and we can talk about sort of being a part of this team. Next slide. So I think I'm probably out of time, but this moving forward, really thinking about how the product ends up being a sort of a permanent fixture in our menu cycle at MIT and in these campus partners, really building that market, exploring new farm partnerships, creating these distribution channels that work for campuses. I'd love to integrate a research and education component into this. We haven't sort of done that yet, but this is a 3-year grant. We're just in year 1. And we are developing a playbook that we can send out to everyone this summer, which talks about how to use the product in your institution. And in the future, just putting a pin in a larger discussion as this food justice work continues, really trying to focus on the surplus food that campuses are generating and thinking about food recovery. So that's just a plug for a future conversation around that. And I'll stop there.
All right, thank you so much, Susy, and thank you so much to all of our panelists. I feel like this was such incredible yet very distinct information. Everyone has their essentially niche project that's been happening at their institution. So I think there's a lot of great advice to take from everybody. And I think that's probably the first question that I want to get started with is if each of you could offer advice to the institutions present here today that are looking to start a climate justice initiative, what would you give them, and what struggles, what challenges did you run into, and what advice essentially would you share with everyone to overcome those struggles? I don't know, Dr. Goldman, maybe we can start with you.
Sure, I'm happy to start. Thanks to Leah and Susy for those incredible presentations. I'm excited to talk to you both more now that I've seen these. And I mean, for us, it was really about marrying a need for the population that we serve. I was seeing this regularly in my clinic, that people were very stressed about utility bills, and then saw an opportunity that, it ended up, we had to be a little flexible about the original vision, as I mentioned, but finding a way to address the needs of the community, letting those needs be the driver, and then seeing where opportunities exist to address those. And I also just want to say I didn't want to take up too much time in my presentation, but if others want to join in our model of climate justice, it's easy for other institutions, organizations, businesses, property owners to partner with us. You can build your own solar or use existing solar and donate to our patients. It's really very simple. We just fill out a form, and you can transfer credits from your solar array to our patients, and we can it's actually quite straightforward, and it doesn't even have to be a long-term commitment, because these, as I mentioned, patients are in the program for 12 months, so you can try it and see how it's going for your institution. You can help 10 patients, to begin with, and it's not an expensive proposition. You can try it. So I would just encourage people to consider that. And if you want to apply for Inflation Reduction Act tax subsidies and bonus credits, then that would be more involved, and it would be a more in-depth conversation. It would involve developing new solar, but just want to put it out there. And also the last thing I'll just say is I see that Tilak Subramanian is in the audience. He's an incredible partner at Eversource, who's also been a very key partner in doing this. They're helping us transfer the credits. They've also supported the program, so thank you to him.
Anna, if you want to share that resource with me, the form, I can send it out in an email afterwards to everyone.
The form is the Schedule Z form. It's a kind of a technical form. People should just reach out to me directly if they're interested.
Perfect. All right. Yes. So for everyone watching, recording, if you are interested, please reach out to Dr. Goldman.
Yeah, please.
Leah, do you have any advice for people who are trying to do such a large scale initiative or even something smaller at their institutions?
Yeah, I think what Anna said about like marrying the work with a need is key. And I think that shows up in each of our presentation in different ways, which I found really interesting. For us, it's really about relationship building. And I think that process piece up front is all too often what gets cut. We're ready and eager to jump to impact. There's urgency all around us. But I think that we really need to be putting in the time and effort to establish those relationships so that we can be doing this work really and truly in collaboration with those who are most impacted. And that takes a lot of time and energy and resources, certainly, and resources in particular around compensating community members for their time in these processes. That's something that we were able to find a way to do with our steering committee members, basically hired as sub-consultants, and other ways to compensate folks, in particular community members, for their participation at various meetings, trainings, surveying, et cetera. So that's really, really important. And it shows that you value their expertise. It shows that you value their time. And it shows that you are committed to a regenerative process and not an extractive process that is taking things without that compensation and that experience. And then I think the other thing that I've been reflecting on and would love to share in terms of the community conversations that we just had, having those pieces of art on the wall for folks to see. And then we also had some like poets and artists performing, and we had spoken word and hip hop at the events. And I think like having that being heard and seen in those comments about housing, about displacement, was a bit of I don't know, it just opened the door for conversation, because I think especially for community members coming into the space, like they didn't have to be the one saying those things or harping on those things. And they still did to a certain extent, but it was already being said and it was being presented, as part of Northeastern's process. So it's saying like, we hear you, we're showing you this is important to us. And I think allowed there to be a more open conversation about solutions. And we were able to get there quicker because we were acknowledging upfront some of the harms and some of the impacts and some of what we're hearing throughout the process.
Thank you for that answer, Leah. I think there's so many lessons to take from that. And yeah, especially if you're building like grounding and community need might be like the most obvious part, but maybe the most challenging part to truly like really make sure that you're listening to the community and addressing them in a collective manner. Susy, do you want to share anything that you have?
Yeah, I'll just add just a simple strategy that is certainly part of my repertoire, but it's just to sort of like get curious and go to things. So to Leah's point around building relationships, there's so many cool people doing amazing work in the climate and justice space right now. And they have like work parties, they have events, they have cooking classes, they have all kinds of things that go on all of the time. So, taking some time to actually just go and explore and see what they're up to, and then eventually figuring out how might I plug in or partner. And that might be 3 years, 4 years, 10 years down the road. But I think sometimes, those things happen quickly and sometimes they take time, but just getting curious and just going to things.
especially in a city as as big as Boston, where there's, like you said, something happening every night, every weekend. Something somewhere is always happening. So definitely encourage everyone to keep an eye out on those newsletters that we all delete from our inboxes. Susy, while I have you, there's actually a question from the chat. Do you find that community members outside of MIT frequent the diverse cuisine in the Student Center?
You know, I don't know if anyone has seen our student center. It's called W20. It's like a brutalist building. It is not clear that there are food spaces inside of it. So unfortunately, it's not very a public facing place. People are welcome to come and eat there, but I think it is mostly a campus community space and visitors and things like that. So it's not a very flashy ground floor retail kind of space, but I mean, it's a great point around sort of eventually sort of drawing more people in and finding a way to connect like people in the community to that space. So that is a little bit of a challenge with that space in general.
Yeah, but an opportunity to grow for sure.
Totally.
And so the next question is also from the chat, and this kind of goes back to, Anna, what you wanted to talk about a little bit with the IRA, but in general, for all three of you, what kind of public policies have you, if any, have you relied on that may support or complement or amplify your projects or this kind of work? And maybe, Anna, since you had mentioned the IRA, I can start with you.
Yes, so the Inflation Reduction Act, I think probably most, if not all of you are familiar with this, but it's the landmark climate legislation that was passed in 2022, signature Biden administration policy package. And so it incentivizes the development of renewable energy, and there are additional sort of adders or bonus credits for environmental justice initiatives. And the way it works is you can kind of stack the investment tax credits. And I won't go into the nitty gritty necessarily, but basically we're getting 40% of the entire basis, meaning like the entire cost of developing the project. 40% of it is paid back to us by the federal government because we used prevailing wages and apprenticeship model. It's a renewable project, and actually we're building on a brownfield. I didn't realize this before I came to this work, but all of Boston is apparently a brownfield, so we get that credit, which is an extra 10%, and then another 20% on top of that because we're directing at least half of the energy we produce. In our case, we're actually directing all of it from this array to low-income households, and there's certain categorical eligibility criteria for that. You can also check people's income to determine whether they're a low-income household, but in our case, we're just verifying their Medicaid status. So everyone in our program has Mass Health, and so that's an easy way to categorically determine that they're a low-income household. And so so that part of the credit you actually have to apply for. We did apply. There's a cap as to how many projects they can fund, and it's way oversubscribed, unfortunately. So they're closed for the 2023 year. We did get approved for that credit. It's called the Low Income Communities Bonus Credit, which we were very happy about. And they'll reopen for 2024, but it looks like there's just way more projects than can be funded, unfortunately. But it's been a really exciting experience. So all told, we expect to get 60% of our total installation costs covered through the Inflation Reduction Act. And it's called a tax credit, but the IRA closed a loophole or dealt with a problem that's historically been there where organizations like nonprofits and government institutions can't take advantage of tax credit mechanisms. It includes a direct pay mechanism where you can actually just get a payment from the government, even though it's so as a nonprofit, we don't have that tax liability, but we do get this through direct pay. So it's fantastic. And then we also get a smaller amount of subsidy through the SMART program, which is a state level program that pays us a little extra per kilowatt hour that we produce because we're directing it towards low income households. Yeah, so that's been so definitely our program has hugely been enabled and relied on both federal and state subsidies.
I can tell you from experience that there are so many out there, even from the knowledge network that the GRC has set up, that the IRA has been a bit of a mystery to people, but it can be so supportive for a lot of these projects. So definitely I recommend looking into these resources. And also if you have any questions for Anna in particular directly, she put her email in the chat. So that's there.
Mhm.
Leah, as I'm so curious to hear what you think and what your advice could be and what policies you supported and have relied on, especially coming from both Providence and Boston and now working in higher education.
Yeah, it's a great question. And I think that, I'm thinking the things that come to mind initially are BERDO and the IMP process, institutional master planning process. Both are really helpful in getting the conversation started because they force us to do something, right? They force us to invest in our buildings. They force us to reduce our emissions. IMP forces us to think about our planning and development and the impacts on community and mitigate that impact. But they don't necessarily, and I know there was a lot of intention that went into BERDO in particular about setting up the Equitable Building Investment Fund. I may have butchered that name, but there was a lot of effort that went into centering equity and ensuring that policy had a justice and equity component to it. But at the end of the day, it's really up to us as an institution to make decisions with guidance, of course, from the city. On the IMP, as I mentioned, Carter Field was really a project the city wanted to get done. And some community members supported it, some didn't, and we're required to do some community engagement around our community benefits. But when it's a city of the mayor when it's a project the mayor really wants to see done, that's going to be prioritized, and that's going to, because it's ultimately the city's decision, or the BPDA's decision. And so yeah, we're hoping that we can again start to shift away from this transactional approach to our impacts and really think about how can we reduce those impacts so we have less to mitigate. So that community are benefiting from Northeastern's existence as a whole, rather than seeing us as a burden or something, an impact that needs to be mitigated. But there is, I can also appreciate from the city's perspective, there's sidewalks that need to be repaired, there's parks that need investment, there's lots of investments to make in these neighborhoods, and the city doesn't always have the resources to meet those needs. So there's, I think, a bit of a tension there that we'll have to navigate.
Absolutely. Yeah, but I think a lot of our audience members are from higher ed institutions, and a lot of the people we work with at the GRC, as you know, Leah, are from higher ed. So definitely a lot of advice to take away from. Susy, what about you? Did you rely on any policies when you were building up your work?
Yeah, not so much relying on any kind of state or local policies per se, but I'd like to think that food justice has really come back into the list of priorities in the lexicon of people working in the fields in the food space in the last sort of decade. I think it was prominent and then it kind of faded, and I think it has been renewed. So I think having an Office of Food Justice at the City of Boston, the City of Boston adopting the Good Food Purchasing Policy, I think having these institutional commitments to supporting food businesses that are minority or BIPOC or women-led. I think the climate right now is very supportive of exploring kind of a sustainability or climate initiative with a food justice aspect in it. I think the World Resources Institute and their kind of cool food pledges really put that sort of plant forward commitment on the center of the stage for folks, and folks like Healthcare Without Harm that are really bringing those worlds together to have certainly informed the ability to push this stuff forward in a campus landscape.
Absolutely. So TLDR from our panelists, look at what's happening in Boston, rely on others in the community, and check out the policies that are happening and the ones that you may not think of that could support your work. So there is another question from the chat. There's a couple actually. So first is, do you all have any suggestions for institutions that might be looking for funding to support future efforts? No, let's start.
I'll just give a quick shout out. Tanya just put in the chat in terms of funding that the New England Food Vision Prize is accepting another round of applications. So that's certainly the way we've funded this work that I've been talking about today. So definitely putting in a plug for that.
Yeah, I mean, I think it depends a lot on what the project is. You know, certain funders have interest in specific projects. For example, Kendall Foundation is very food oriented. Boston Medical Center actually was the first hospital to issue green bonds, which is a financing mechanism where we actually issue our own bonds, basically borrowing money, and it has to be used on a project that's about climate mitigation or resilience or decarbonization. So it's a mechanism that hospitals haven't really been doing, but so we were proud to be early in that space. There's also the Green Bank in Massachusetts to take out money for projects that are oriented in, usually larger infrastructure projects, but then, obviously foundations and local grant making organizations. City of Boston, has some great mechanisms for funding. So, I mean, yeah, I think it really just depends on your project.
Absolutely. And Leah, I know you talked a lot about, the next 10 years, Northeastern has funneled money into this project, but do you have any other recommendations for funding sources?
One that comes to mind right now is the EPA's community change grants, a really great opportunity, very much focused on this work. So look there, it's a rolling application, and they do emphasize cross-sector partnerships. So whether that's higher ed and community or government, that sort of thing.
And if anyone else in the chat has any other recommendations or resources, feel free to share with the group, and we can definitely capture those and send them out in an email afterwards. So, we're coming up on time here, so maybe a couple more questions. There is a question from someone who works at Project Green Schools. How can K through 12 schools collaborate with your work projects? And Susy, I think we talked a little bit about this at our meeting a couple weeks ago, about, Boston Public Schools and how like the food systems across Boston are pretty intertwined. Do you maybe have a way that K through 12 schools can work on your project at MIT, or is that kind of like still in the beginning stages?
Well, certainly while it isn't directly linked with us, I know that through our fritter project, sort of developing the supply chain and the product and all of this, it's certainly meant to support not just higher ed, but all institutions who might care to purchase the product. So certainly reaching out to me afterwards, there might be space to expand sort of the field fritter project to look at K-12 involvement for sure. I think Boston Public Schools will be joining or at least sort of testing out the product in the fall. So certainly on that front, but then there's, all these great networks, whether it is the Farm to Institution New England or the Green Ribbon Commission, that are exploring, especially around food purchasing. If you are part of an institution, we're all dealing with the same kinds of questions and struggles. And the more you can kind of band together, I think the greater impact you can have. So whether that is, starting an initiative to support Black farmers in New England, or the more purchasing power we have as a group, the better to sort of shift things. So certainly worth, a follow-up around how to better connect the K-12 and the higher ed institutions in Boston doing food work and beyond, for sure.
Absolutely. Leah or Anna, do you have any networks to work with the K through 12 schools in Boston?
I did mention we are working with Madison Park High School, and that's right, pretty close to our campus, and definitely aligned with the work we're doing with our needs and their needs. So that's been a great partnership with the apprenticeship program there, but open to other partnership models as well.
Yeah, and I would, I mean, we have other program. My particular program that I presented about, Clean Power Prescription, does not have a formal relationship now. I'm more than happy to, consult with schools that may be interested in setting up their own programs. They have their own people to serve, and I would imagine they'd want to direct the power to their students who are energy insecure, as opposed to sending it to us. But I would be happy to support efforts in that direction. And I know I live in Somerville, and there's a movement afoot to decarbonize schools, and maybe some of it can be. I've talked to our school board rep about our project, and to sort of put forward the idea that some of it could be used to help students directly. So we'll see more about that.
So Dr. Goldman, actually, this is a question that I had for you as well. And there's this question specifically for you in the chat. How to make so there's this kind of this long question. So, the Clean Power Prescription is short-term right now for now. It's like a short-term sign up for a year. Do you have opportunities or ideas of how to make this longer term, and how others can support this work in addition to donating solar credits for patients?
Yes, thank you for the question. And also, I just want to acknowledge Frank Hennigan's note in the chat about off-balance sheet funding models to pay for large efficiency upgrades. That's great, and I will follow up to hear more about that. So I mentioned the sort of other big piece of our program is referring to ABCD for home retrofits. And the extent to which those actually occur, because there's sort of different levels at which they can occur. They can be kind of as simple as just changing out the light bulbs. That's very easy to do and doesn't really involve anything from any real time commitment from the patient, or in many cases their landlord. The majority of our patients are renters, many in the Section 8 housing program. So they're there with vouchers, and so it's a coordination effort between the resident and the landlord in many cases, which creates some barriers. The work itself is funded by Mass Save. So these, for low-income households, ABCD does not charge for these services, which is amazing. So I mentioned it could be as simple as kind of changing out light bulbs, that you can get to larger appliances that you upgrade, and then you can get to weatherization, better insulation, to improve the kind of tightness of the envelope for heating and cooling, to make the house more efficient, and then window repairs, that kind of thing. And then there's all the way up to changing out the furnace for a heat pump. They don't do that for gas furnaces, for natural gas furnaces, because it increases the cost so much for the resident, because the heat pump, like the electric bill, basically goes up quite a bit when you install an electric heat pump as opposed to a natural gas furnace. So unfortunately, they're not actually able to do that yet. One of the things I'm working on is advocacy at the state level around getting a rate design where people wouldn't see, low-income residents wouldn't see such a large increase in their bill if they did decide to electrify, because that's a barrier for a lot of low-income homes. And then in terms of longer-term plans to help patients connect with clean energy, another sort of legislative priority and thing that I'm advocating for is a better way to connect to community solar arrays for low-income people. So the community solar model is basically, there's a large solar array somewhere. It could be on a rooftop, it can be out in a field, and then you basically have a share in it that covers your energy needs, and it shows up as a credit on your bill. And for most people, that will be less expensive than if they were just buying typical energy on the grid. So it's a way to access solar without needing the capital to put in your own solar arrays on your house, or if you don't own your house, or if your roof's not suitable, or all kinds of reasons why you couldn't do it. So right now, it's harder for low-income people to access community solar, because we have a double billing kind of protocol in Massachusetts, where there is a bill credit that shows up on your bill, but then you have to separately pay in you get two bills essentially every month, and you separately pay the community solar provider, as opposed to having a consolidated billing plan. And also in Massachusetts, pretty much all of the community solar providers have a direct, they debit your account directly. So it's like a direct pay mechanism so that people actually pay. But for low income people, that's kind of a no-go. It doesn't work for them to have someone directly debiting their account. So it effectively kind of bars most low income homes from accessing community solar. And that to me is a really key step forward. So then if we fix that and got consolidated billing, the other thing is that once it's sort of a direct partnership between the utility and the community solar developer or owner, then people can fall behind on their bills a little bit and have that cushion of not having their service turned off. They still, which is, not ideal, but it's the reality for many low-income homes. And they still get their community solar, still have their service, as opposed to the double billing where they're getting overdraft fees and things like that. So that's a long way of saying that is my long-term goal. I would love to graduate people from clean power prescription into a community solar contract that lasts 20 years. So they have, or however long, so they have access to community solar in a long-term way. But we have to fix that double billing issue at the state level first. So that's.
As with any long-term goal, there's always some sort of structural process that needs to be changed for true progress. That's absolutely true. Leah, my last question's for you. I'm sure you've gotten this question several times from your community partners and the people attending your events and the different planning stages. How have you been addressing accountability and sharing that with your community?
Yeah, it's a great question, and one we're actively working to answer. Again, it's really about building those relationships, and this work is not meant to be a one and done. I think oftentimes we get so focused on finishing the plan, delivering the plan, and the plan is almost not the point, right? The process is really the point, and the process is probably more of a powerful outcome, given the relationships that you build through that process and the work that can emerge from that. So while I am very excited to get a plan done in the next couple of months here, it has been about a year and a half, really more if you consider the time of scoping the project and getting the RFP out and all that. It's been close to 2 years in the making. And so as we move into that implementation, we're going to be having conversations about how do we maintain these relationships and keep our partners not only informed, but really a part of the implementation. Some things will be more informing, and we'll provide updates, and then other things, other actions or strategies will have more and will require more of a collaborative implementation model that we'll be working towards. So one example, we're kicking off our decarbonization planning process for Northeastern to really it's a engineering heavy study that will help us understand what are the changes that we need to make to our energy systems and our buildings on campus to fully decarbonize our campus. And we're starting to pull in some of the partners that we work with on the Climate Justice Action Plan into that process to help. So they are there and they are have an opportunity to shape that work, the decarbonization work as well. So as we decarbonize, we're thinking about what are the impacts that our decarbonization might have. Are we going to suck up all of the remaining electrical capacity in the grid so our neighbors can't electrify? These are things that we need to consider as we move forward. And so we're hoping that they will be a part of that process as well and work with us to continue to shape that. So it's just the starting point, and accountability, I think, really comes from continuing those relationships and co-creation model throughout implementation.
Absolutely. I think it's the backbone and the foundation of climate justice work in general. It's building that trust, supporting and maintaining trust amongst your community. And so I think a really great note to end on, honestly. Thank you so much to all three of you for your presentations, to your work, and for your continued support in the climate justice sector. And for Boston, we're really excited to see where your projects go. And thank you all to everyone who joined this recording, and the slides will be up on our website. We'll share the resources in the chat, from the chat. And if you have any questions, please let us know. My email is on the screen. And thanks so much. We'll see you all at the next program. Bye, everyone.
Take care. Thank you.